Hi, my name is Kelly Cascario, and this is my presentation for my health education to the underserved population of Colton. I completed my health education classes at the Lawrence Hutton Community Center in Colton. It is a senior citizen community center that provides a place for them to have social interaction. It provides coffee and toast in the morning, lunch, and other fun activities throughout the year. So the topics that I presented on were nutrition and exercise, diabetes, high blood pressure and high cholesterol, and medication safety. The background and significance for these classes. For nutrition and exercise, stakeholders report that many community members have a poor diet and that fast food restaurants in Colton are always very busy. They also stated that it is not a city where members are seen outside running or participating in some other form of exercise. Community members also admit that they have a poor diet and they struggle with being overweight. Census reports show that 24.2% of adults in Colton are obese. This is average for all the cities within San Bernardino County. Diabetes stakeholders report that there are high rates of diabetes among the members in the community. Most community members I spoke with were either diabetic or had someone in their household who was diabetic. Census results showed that annual hospitalization rates for diabetic patients in Colton is 26.1 per 10,000 residents, which is on the high end of all the cities in San Bernardino County, and 8.5% of adults have diabetes in Colton, which is in the middle of all the cities. For high blood pressure and high cholesterol, stakeholders were unsure of the incidence of heart disease and stroke in their community. They speculated that due to the unhealthy lifestyle, there was probably a high incidence of at least high blood pressure and high cholesterol. Community members report that they have never had heart disease or stroke, but when asked specifically about high blood pressure, they said yes, and with cholesterol, they were unsure. The census reports show that 37.6 per 10,000 adults in Colton go to the ER annually due to high blood pressure, which is among the highest rates in the county. For medication safety, stakeholders report that they feel that their adult members take a wide range of medications without knowing what they take them for. Community members admit they do not know all of their medications, they do not carry a list of medications, and they take their medications only when they remember to. The median prescription drug use rate in Colton is 1.3 prescriptions per resident. The county average is 1.6. My classes covered the Healthy People 2020 objectives that were nutrition and weight status, diabetes, heart disease and stroke, and medical product safety. For my needs assessment, I chose my topics for my classes based on several different findings. First, I did a Winchell survey and made note of concerns that I saw within the community, like obesity, numerous fast food restaurants, few people out exercising, and so forth. Next, I interviewed key stakeholders in the community to find out what some of their concerns were and what they felt were some of the bigger health concerns in the community. This information gave me multiple ideas for classes to hold. I then met with one more stakeholder, who is the director at the Hutton Center, Heidi Stretch, and she gave me what she thought were the biggest concerns for the members at the center. I then picked 4 topics that she gave me that were also on my list from my Winchell survey and other interviews. Lastly, I looked at some online databases to confirm that these were definite health concerns for Colton. So the theoretical framework that I used was the precede-proceed model. This provides a template for the process of conceiving, planning, implementing, and evaluating a community intervention. Precede stands for predisposing, reinforcing, and enabling constructs in educational, environmental, diagnosis, and evaluation. As its name implies, it represents the process that precedes or leads up to an intervention. Proceed spells out policy, regulatory, and organizational constructs in educational and environmental development. And true to its name as well, it describes how to proceed with the intervention itself. Both parts of the model have 4 phases. I used the phase and the precede section to help develop each of my classes. The first phase helped me to determine what the ultimate outcome of my class should be. Based on my findings from the stakeholders and epidemiological data, the next phase helped me to identify the issues that could affect the outcome identified for each topic. Phase 3 then identified the factors that would create the behavior and environmental changes. Lastly, Phase 4 helped me to evaluate the location I chose to do these classes. The PROCEED model involved me actually doing the classes and evaluating the process, impact, and outcome objectives of the class. According to Folling, Zolger, and Helvig, some of the behavior changes that are needed to change to a healthy lifestyle are getting rid of old habits, implementing what you know, not letting emotional baggage hold you back, and do not allow yourself to relapse. Barriers are changing old habits can be very challenging and sometimes feel impossible. Emotional baggage can prevent someone from believing in themselves, and if not acted upon quickly, one slip-up could lead to a relapse. The asset is a lot of people know what they need to do, so the knowledge base is there. To make these changes, people need to be determined, have motivation to keep them on track. They also need to keep a positive attitude and have self-management skills. Lastly, they need to know what it means to eat a healthy diet, and they need to know what counts as exercise and how much they need to exercise. To be successful, people have to have some sort of support system to encourage them along the way. People should also have a guide so when they have nutritional questions, they can look it up. These guides can be obtained for free online or from their doctor. People also need exercise apparel. This can be as simple as a t-shirt, sweatpants, and comfortable shoes, or a bathing suit, but it does not have to be anything expensive or fancy. People may also need transportation to help them get to their doctors, the pharmacy, and the grocery store, and so forth. There are also many options for cheap transportation within the public transport systems. The community itself needs public health nurses to promote healthy living, clinics where people can seek medical help, support groups to help them stay on track, and wellness centers to work out and learn about nutrition. Communities can also make stricter smoking laws, like no smoking in public, and restrict the number of unhealthy restaurants allowed in the community. So my intervention for nutrition and exercise, it focused on the health-related problems of poor diet, sedentary lifestyle, and obesity. The Healthy People 2020 objectives that it covered were increasing the proportion of adults at a healthy weight, reducing the consumption of saturated fat, and increasing fruits, vegetables, and whole grains in the diet. The technique and format I used was an interactive lecture, posters, handouts, and a Q&A session. I started off the class by talking to the audience about their eating habits and exercise habits. This gave me an idea of what I needed to enforce in my teaching and what understandings they had. In my class, I talked about nutritional changes that are needed as you age, since I was teaching senior citizens what food does for the body, recommendations for caloric intake, the food guide pyramid, tips for eating healthy, the benefits of eating healthy, risks of eating unhealthy, the importance of exercise, and I demonstrated some mobility and stretching exercises. After teaching, I allowed them to ask questions, and I answered them. Then I asked them the questions and gave out prizes to those who participated. The questions I asked were based on my objectives and helped me to reinforce the critical things I wanted to make sure they knew. These are the posters that I used for my class to help give a visual to reinforce the learning. I included a picture from My Plate that explains how to ensure you're eating food from the right food group, as well as the food guide pyramid. I also included pictures of empty calorie foods, foods with good fat versus bad fat, the best fruits and vegetables to eat, how to read a nutritional label, and how choosing the right foods can make you more full while having less calorie intake. The apples were little notepads that I gave out at the end for those that were able to answer objective questions and other questions from what they had learned. My intervention for diabetes covered the health problems of uncontrolled diabetes and complications from diabetes. The 2020 objectives it reviewed were to improve glycemic control among diabetics, increase prevention behaviors in people with prediabetes, and reduce the number of newly diagnosed diabetics. I started off this session, and my technique and format were the same as for my first class. I started off this session asking the group what they knew about diabetes. In my class, I focused on the types of diabetes, symptoms, especially of hypo and hyperglycemia, complications with diabetes, tests for diagnosing diabetes and for monitoring your management of diabetes, how to manage my diabetes, tips for other body systems to have evaluated when you're diabetic, special tips for seniors, diabetic medications, and how to support a loved one with diabetes. I once again allowed time for them to ask any questions, and then I asked them questions to reinforce their learning. So these are the posters I used. There was information on types of diabetes, causes of diabetes, how to prevent it, signs and symptoms, how to check your blood sugar, normal blood sugar values for the different types of tests, complications of diabetes, hypoglycemia versus hyperglycemia, and different instruments to administer insulin. The vegetables are stress balls that I used as prizes for those that answered my questions correctly. For my high blood pressure and high cholesterol class, it covered issues with uncontrolled high blood pressure and high cholesterol and heart disease. The 2020 Healthy People 2020 objectives that were included were to increase proportion of adults who have their blood pressure screened every 2 years, increase the proportion of adults who have their cholesterol screened in the last 5 years, and increase the proportion of adults with high blood pressure whose blood pressure is under control. I once again used the same interactive lecture, poster, handouts, and a Q&A session. I started this class by asking questions to see what they knew about high blood pressure and high cholesterol. In this class, I discussed what blood pressure is, what's considered high blood pressure, types of high blood pressure, causes of high blood pressure, risk factors, how to prevent it, signs and symptoms of a hypertensive crisis, complications associated with it, treatments including medications, what cholesterol is, what high cholesterol is, the lack of signs and symptoms with it, modifiable and non-modifiable risk factors, treatment including medications, and complications of high cholesterol. I once again allowed them time to ask questions before asking them questions and giving out prizes. My posters for these classes included information on what cholesterol is, foods high in cholesterol, complications with high cholesterol, normal levels of cholesterol, modifiable and non-modifiable risks, how it can affect different areas of the body. The high blood pressure poster included different sphygmomanometers, what causes high blood pressure, what blood pressure is, the normal values for blood pressure, ways to prevent high blood pressure, and complications. My prizes for this class were lanyards that said Healthy Heart on them. For my medication safety class, I went over noncompliance with medications and not taking meds safely. The Healthy People 2020 objectives were reducing ER visits for overdose on anticoagulants, reducing ER visits from overdose on insulin, and reduce the proportion of patients suffering from untreated pain. Once again, I used an interactive lecture, poster, handouts, and a Q&A session. I started this class by asking what medications people took. Very few people knew what they took other than a water pill or blood pressure medication, and nobody carried a list of medications with them. During the class, I talked about what medications are, prescription versus over-the-counter versus herbs and supplements, brands versus generic medications, benefits of medications when used correctly, risks associated with medications, improper use of medications, drug interactions, how to prevent problems when taking medications, communicating with your doctor about medications, monitoring with certain medications, important information for seniors on medications, and cost of medications. Like my other classes, I made time for them to ask me questions, and then I asked questions to reinforce their learning. The posters included what a medication list could look like, how to read drug labels, prescription versus over-the-counter drugs, a pill box, reminders to talk to their doctor about medications, knowing the benefits versus the risk, the logo to know that an online pharmacy is approved, and then on the other poster had tips for managing medications. My prize for this class was decks of cards shaped like Band-Aids. So for the budget, providing health education classes is relatively low cost. The salary for one nurse to run the program is estimated to be about $70,000 a year. Supplies such as handouts, posters, and prizes would be an additional $5,000 per year. San Bernardino County has an existing budget of $4.5 million per year for public health services, which includes money for community outreach services. The community is very supportive of health education classes and could use a current employee to do classes to help minimize costs. The organization that the classes would be held at merely needs to supply a place and time for the class. Some necessary training that would be needed at the organization is training the chefs to cook healthier meals that meet the food recommendations. So my objectives for the nutrition and exercise class, the impact objectives were that by the end of the class, 75% of the participants would be able to list 4 low-impact exercises, 3 benefits of improved nutrition, 2 risks associated with eating unhealthy, and 4 foods with empty calories. The outcome objective was that within 1 month of the class, 75% of the participants will be eating a minimum of 3 servings of vegetables a day and exercising a minimum of 3 days a week. Success for this class was shown in the positive feedback I received, including the participants agreeing to start working on eating healthier and exercising, and in my impact objectives being met. To measure my short-term goals, I asked questions at the end of the class to ensure there was retention of the information and to reinforce their learning. To measure my long-term goals, I would do follow-up calls and survey the participants on their typical daily diet and exercise habits. For diabetes, my impact objectives were that by the end of the class, 75% of the participants will be able to list 3 factors related to developing type 2 diabetes, list 2 ways to help maintain their diabetes, list 4 signs and symptoms of high blood pressure or high blood sugar, and 4 signs and symptoms of low blood sugar. My outcome objective was that within 3 months of the class, 75% of the participants will lower their hemoglobin A1C level below 8. Success for this class was shown in the positive feedback I received, including the participants agreeing to work on managing their diabetes better or working on their prevention strategies if they did not have diabetes, and in my impact objectives being met. To measure my short-term goals, I asked questions at the end of the class to ensure there was retention of the information and to reinforce their learning. To measure my long-term goals, I would do the follow-up calls and survey the participants on their most recent hemoglobin A1C results. For the high blood pressure and high cholesterol, my impact objectives were that by the end of the class, 75% of participants would be able to list 3 modifiable risk factors for high blood pressure, list 2 ways to lower their cholesterol on their own, 3 things that can cause their blood pressure to go up, and 2 signs and symptoms of a hypertensive crisis. My outcome objective was that within 3 months of the class, 75% of the participants will show a steady decline in their LDL levels. Success for this class was also shown in positive feedback I received, including the participants agreeing to work on controlling their blood pressure and cholesterol levels, and in my impact objectives being met. To measure my short-term goals, I once again asked questions at the end of the class. To measure my long-term goals, I would do follow-up calls and survey the participants on their last 2 cholesterol readings. My impact objectives for medication safety were that by the end of the class, 75% of participants would list 2 items to include on a medication list, 3 reasons to take medications as prescribed, 2 reasons to get medications from the same pharmacy, and 2 questions to ask the doctor about a new prescription. The success was also seen in positive feedback and in participants agreeing to make medication lists once they got home, and in my impact objectives being met. To measure my short-term goals, I once again asked questions, and for my long-term goals, I would return to the facility and ask the participants to show me their medication list if they had one. I feel my classes were overall very successful. By the feedback I received, I could tell the majority of the participants were interested in making a change, learned something from the information I provided, and were using the handouts at home to reinforce their learning. After my last class, I thanked the staff for allowing me to present at their location. They were very grateful for my class and even expressed that I had done the best out of many students at keeping their attention throughout the class. Some weaknesses that I picked out were that people trying to ask specific questions, but without knowing their health history, I was not very helpful to them, and that classes did not initially have holistic treatments, which I did add to my last 2 classes. Problems during the class included side conversations, making it hard for others to concentrate at times, and I did have at least one unsatisfied customer who did not have much belief in medical personnel. If I were to do any further classes, I would ensure that it was not at mealtime. Unknowingly, 2 classes were scheduled when they would be eating, and this was a distraction to the class. I would also try to start and end the presentation on a positive note, so the depressing factors of aging and declining health was not the first or last thing they heard. I also need to remember that while I may have done my best, not everyone will always be satisfied. And these are the references that I used. I hope you enjoyed my presentation and thank you for listening.